When to introduce solids to my baby. Is your baby showing all the signs of readiness? And why is it important to wait until you see those signs? Let's talk about that.
Hi Mommy, my name is Mary Cahill and I'm a certified lactation counselor. I use correct and easy to understand information to help mommies like you to be confident and successful in their breastfeeding journey.
This is a fun and sometimes scary stage to introduce solids to your baby. American Academy of Pediatrics says that babies are ready for solids at around 6 months. And just so you know, solids also include baby cereals. So around 6 months, your baby might be ready for solids. Some babies a little sooner, some babies quite a bit later. There's no right or wrong, but there are some signs to look for to see if your baby's ready. What are those signs? If your baby can sit up unassisted, hold their head up, not fall over, then your baby is showing a really good sign that they're ready for solids. Another one would be if you were to give baby a few bites of solids and baby was able to push it into the back of their mouth and swallow, then that's a sign that baby's ready. If baby has a thrust reflex where it's pushing the food out with their tongue and not swallowing, then that's a sign that they're not quite ready yet. So you want to be sure that baby can swallow. And if baby can grasp things with a pincher on their hands, and that means not to scoop foods up into the palm of their hands, but if they can pinch to grasp the foods, that's a good sign that baby's ready. Is baby showing signs of being interested in what you're eating and in what you're trying to feed baby? There's a big confusion about if baby is interested in it or if baby just wants to chew on whatever you have. If you give baby a toy, they'll put it in their mouth and chew on it. Doesn't mean that baby wants to eat the toy, but that's how a baby explores things. When baby is showing the outward signs of readiness, that's when you know that baby's also having some readiness to be able to digest these foods. The American Academy of Pediatrics says that babies should be fully breastfed until about 6 months. You may be using breast milk and formula, and that's totally fine. But baby's not ready for solids before around 6 months unless they're showing all of those signs of readiness. When solids are added too soon and too much, it takes away from how much the baby can eat of breast milk or formula. If you're breastfeeding, it's going to cut down on your milk supply if baby fills up with solids too soon. It's also going to reduce how much baby can eat, and sometimes when baby's given solids too early, you'll even see them lose weight or stop in their growth for a short time. Solids are not as easily digested as breast milk or formula by baby. Formula-fed babies absorb about 3 to 12% of the iron in the fortified formula. Breastfed babies absorb about 50 to 80% of the iron in breast milk. So it would be better to wait until baby is truly ready before you start solids, especially if it's a breastfed baby, just because you might as well take advantage of this time when baby can absorb more iron. There's less chances of baby becoming anemic if you're exclusively breastfeeding and you wait until you truly see all of the signs of readiness before you start solids. When you're breastfeeding your baby, it would be good to breastfeed 30 to 60 minutes before you give baby solids. That helps baby to not overeat on the solids and to get their nutrition from the breast milk. And also, the breast milk helps to break down the solids and helps baby's body to absorb and digest them better. If baby gets solids before breast milk, baby may wean sooner. Mom's milk supply could be reduced because baby's filling up on the solids and not hungry for breast milk. When you start solids, it should just be taste in the beginning. It should be a complement to breastfeeding or formula. Baby will slowly start to eat more and more solids as you get closer to 1 year. But breast milk or formula should still be their main nutrition source. Breast milk is 88% water, so if your baby is fully breastfeeding on demand, then they don't need extra water unless they're showing signs of being constipated. If they are, then you don't want to add more than about 4 to 6 ounces of water a day. And it's best to give that to baby in a cup or a straw because it's fun to drink from a cup and to learn the coordination skills. You'll know that baby is constipated if their poop is firm, dry, or if they're seeming upset or in pain when they're pooping. Enjoy this time with baby, where they're getting used to so many new touches and smells and tastes. Try to give your baby some healthy foods and you eat along with them. You can look into different ways to feed your baby. You could go with purees or baby-led weaning, where baby's given more solid foods to eat a little sooner. Let baby explore and handle the food. Don't be afraid of letting baby get a little messy. A great way to start baby on their solids is to use a fresh food feeder. I'm going to link below some great tools that I really like. If your doctor is recommending that you start feeding baby solids before baby is ready, I don't ever want you to go against whatever your doctor is recommending, but have an open, honest conversation and talk about maybe doing some things differently. When you're doing research on your own, don't just look at Dr. Google. Look at some university researches. Look at American Academy of Pediatrics, Lactation League, World Health Organization. Those are some really great places to start. Let me know in the comments below, how old is your baby? And is your baby showing signs of readiness for solids? I hope this video was super helpful for you, Mommy. Please like and subscribe. And as always, Mommy, you got this.